Kaylee Hollowbone thought cancer doctors were doing their best for her mum. In fact, she'd been put on the controversial Liverpool Care Pathway and was being deprived of food and fluids without consent. Only on Kaylee's insistence did they start giving nutrition once again, allowing the family the chance to say their goodbyes before she died.
I think the Liverpool Care Pathway needs to just be completely readdressed. It's not appropriate in every situation. It wasn't in mine. It would have completely deprived me of 3 extra months with my mum, getting to hear her laugh again, her being able to say her goodbyes, us being able to say goodbye as well.
Brian Cobden has cancer and is being cared for at the Hospice of St Francis in Buckinghamshire. Staff here agree personalised end-of-life plans with patients and their relatives. It's an approach that's likely to be backed today by the Department of Health, which says the Liverpool Care Pathway should be phased out because it's too prescriptive and poorly used in many areas. Brian can't fault his care.
I certainly like to be told exactly what's going on, and my needs seem to grow less because everybody seems to anticipate my needs.
But while hospices understand the needs of dying patients, hospitals don't. Palliative care doctors fear treatment will suffer unless there are comprehensive guidelines.
I am worried that if it's phased out, we need something to help people, doctors and nurses who are working in settings that aren't hospices to know and to be confident in having difficult conversations with families, to involve them in decision making and to talk about changing directions of care.
There is some evidence that the Liverpool Care Pathway was being used to hasten death, perhaps even with financial incentives for doctors. Ministers will say it's time to find a new way of ensuring terminally ill patients have a pain-free and dignified death. Thomas Moore, Sky News.